Hi, my name is Jason Lay. I'm an orthopedic hand and upper extremity surgeon with OrthoArizona. So there are a variety of different hand and wrist injuries related to sports. Other than the standard sprains, fractures, dislocations, there are a few that I'd like to talk about that people should be aware of so that they know to seek medical attention sooner than later in order to get the most appropriate care and heal correctly. For a mallet finger, for example, it's when a ball or a player or something hits the tip of your finger and then you get a droop to the finger. If it's a small injury, sometimes it just needs about 6 to 8 weeks in a splint, and then full use of it after that with some rehab. Sometimes when it's a bigger break or a more severe injury, it may need surgery to put everything back in place. But when you notice your finger is drooping or has a deformity to it, that's when you know you should seek medical attention and see a specialist to make sure it's not something like that may or may not need surgery for a good outcome. Another injury is a skier's thumb. It's an injury typically can be seen in skiers where the strap gets caught on the thumb and pulled in one direction, or in other cases when your thumb may get caught in a jersey or some other something else. The thumb gets pulled in a way where the ligament between the bones separate, and then it can be in a position where it doesn't heal correctly. In those cases, then that may need surgery to repair it back down to the bone where it's supposed to be. In other cases, it's not as severe and can be treated in a splint or brace. Another injury that can happen to the finger is something called jersey finger, where someone grabs a jersey or a flag and is playing football and gets their finger caught in it. And then typically it's the ring finger, and then part of the tendon that bends your finger down gets caught in the jersey and then forcefully pulled, and then that tendon actually rips and can even retract down to the palm. In those cases, it usually needs to be seen as soon as possible, and it may need surgery to repair it back down to the fingertip. We'll usually need hand therapy afterwards to regain full function and use. Sometimes ways to know that you have this injury is if you can't bend your finger and it's kind of straight, or you're having weakness bending the finger down. In terms of unique fractures to the hand and wrist is a scaphoid fracture. This is a peanut-shaped bone at in your wrist that's pretty much the keystone of the wrist and a very important part of the wrist. And the problem with this is that if it is broken, it may be broken in a way where it needs surgery, and delay in treatment may lead to it not healing or causing problems with dysfunction and chronic pain. And things you should look out for are if you had fall from a skateboard or playing soccer or something and you still have wrist pain, usually at the back of the wrist in this area called the snuff box, or at the base of the thumb here, and it continues to be painful with normal activity, you probably should go see a specialist to make sure you don't have this type of fracture. When it's caught early, it can be treated appropriately, but if it's left there for multiple weeks or months, it can lead to non-healing and not healing correctly. Something else I'd like to talk about is something called Hamate fractures. This can happen in racket sport players or someone that holds a club or a baseball bat. It can happen in pickleball, tennis, racquetball, and it's when there's a force going into the racket or the club into the base of the palm. Usually, if you have lingering pain at the base of the palm, this may be the injury that you have. There's a small piece of that hamate bone called the hook of the hamate that could get injured and broken, and if it continues to be painful and a problem with playing these sports, then that's something you might have. And typically, treatment may be surgery to remove that small piece of bone and get you back playing the sports that you enjoy doing. So for most ligament, tendon, bone injuries, it takes about 6 to 8 weeks to heal, especially if it's caught early. Sometimes when you seek medical attention later, fractures may heal incorrectly or tendons don't heal correctly. It may be a longer recovery or return to play. But typically, if everything's treated appropriately and you get immediate medical attention, we can get you back and playing what you like to do, whether it be pickleball, golf, skateboarding, skiing, snowboarding, usually within a few months.